upstate is different than this one. It's fine, it's not too much different. I've already hooked everything up. Nothing needs to be changed in this machine. This machine can be used both what we call bagging, meaning a regular anesthesia way, or you can use a ventilator. The only thing you have to change is two things. To set this machine up, you would plug it in like you do any other way, because we have a little converter over here to have oxygen go to both the ventilator. And the ventilator is powered, so there is a power cord back here. You actually have to take this power cord to hook it up to get it working. And this hose is what I had hanging over. This is the hose that you will use. So, the best way I always tell people to think about it is the things that we need to replace are going to just be one thing, and it is your bag. This is how your ISO and your air go through it. And the way you do that for your ventilator is you just pop this off, and this bad boy goes, so when you turn off oxygen, this bad boy goes right there. Bam.
Can you do that when the patient is under?
Correct.
You can
Yes.
change it.
You need to make sure your oxygen is off and your ISO is off before you take your bag off and remove. You can have propofol on the leg. A patient can not take a breath within 2 minutes. It will take you less than 2 minutes to set this up.
Sure.
This is a lot simpler than the one at Upstate. We had to do all kinds of shit and unplug it. This machine actually allows us to be very simple to change it out. So, first things first, if you know you're about to take a patient on a ventilator, you should have already leak test your machine. Does anybody know if you ever had a leak test properly?
I don't have a power plate. You hold off.
I have a little finger, so I actually have to use this to cover it better because my finger's not big enough.
Can't use your palm.
My palm doesn't work very well. I don't have enough fat on it. So I use this. But you have to make sure you're completely covering any leak. So I use this because my finger fits better over this.
So you do that prior to hooking up the ventilator?
Anytime you use the anesthesia machine, you should always...
Sure.
Yes?
Hey, do you have a more nice chart? That little study thing?
Yes, it's right next to the left side of the computer by the library. Anytime you're about to use the anesthesia machine, you should always leak test it no matter what. And anytime you change on a bag, you should leak test the bag. Oh, damn, it's boring. All right, so leak testing always requires doing the pop-off valve. And with the pop-off valve, you close it. And then you just turn on your oxygen just a slight bit, not much. And then you're going to do your flush valve. And you're going to fill it until your pressure says 20. Once your pressure says 20, this machine has a very tiny leak, but very small, but not enough to really affect the machine. The one we have out there, that's a bad leak. And so anytime you're about to be done with this, I always tell people, open your pop-off valve before you let your finger off. So you remember to do it. Yeah, because then you'll hear the bag go down and stuff. All right, so now that we have that, it's been checked, we can actually hook up our ventilator. And the reason do you know why we have to check for a leak in our machine? Does anybody know why before we use our ventilator?
Before you use no.
Because if you have a leak in your machine, your bellow won't properly fill up. And then if you see a bellow go down, that means there's a leak in your machine somewhere, something's wrong. Okay. And it won't work properly. Okay? All right, patients under, our lungs are right over here. These are your fake lungs.
We have fake lungs?
This is a fake lung. You have, this is a pediatric bellow, and that right there is a large bellow. You can change the two.
So would that be cats?
Pretty
small dogs,
easily. It's
or?
actually kind of hard. So small dogs, I could say you could probably go up to about 25, 30 pounds on that one.
Okay,
potentially 40, but you don't want to. Larger dogs, anything over 50 pounds, are going to have to be on that. There is
Can
a
you use
sheet.
this on a smaller dog? Or not good idea?
I would not. Because you got to think about it. If you,
Too much.
what people make the mistake of doing is when they turn on a ventilator and it's all hooked up, is they forget to do the respiratory flow. That basically tells how much of a deep breath that bellow is going to come up and down. That controls the pressure of how much that patient is. Keep a tiny little dog on there, and this was set for a Great Dane. You turn that machine on,
Blow up the lungs.
boom, you're gonna blow up your dog's lungs. Yeah, that's what I'm saying. You have to make sure you check yourself before you do everything with this machine. So you plug it in. This is the only thing you need. Make sure it's on rebreather. Plug this into your bag. This is now your bag. This is your bag. This is no longer where your bag goes. This is. So, and then you have to turn off your pop-off valve.
Oh, turn it off. Okay.
Okay. And so what happens is once you turn it off, you turn up your oxygen and the bellow should stop filling. But you have to make sure your fake lungs are on.
Or your lungs.
Uh-oh. Come on, fake lungs. Get in there. Alright, you're gonna see your bellow start to rise, and you can definitely give it a flush to make your bellow go up faster. And the bellow should stay up like that. It should consistently stay up, okay? Now, anytime you're about to turn this machine on, always make sure your dial is completely turned to the left, especially in your respiratory flow, because this is what's gonna control that pressure, that how much deep of a breath you're gonna give a patient. So that needs to be completely turned to the left. So that means when you turn this machine on, your bellow is not gonna move at all. You have to actually use this to control it. This is your breaths per minute. The respiratory time, this is already set. You don't actually have to worry about changing this one. So what I'm gonna do is I'm gonna show you how the machine get the bellow where it needs to be. So you turn it on, and you'll hear this noise. That is it actually giving a breath. So what we're gonna do is we're gonna change our breaths per minute. I'm gonna go up to 10. And then I'm gonna start adjusting my flow, and I'm gonna watch my pressures. So we need to watch our pressures, and we need to go up on our flow. You can see the bellow start to move because I'm allowing it to give more breath. And you can see your pressure gauge actually showing us that it's giving it a breath. So these lungs are quite small, so it doesn't take too much adjusting on that one. So you can see your lungs filling up nice and smooth. Your pressure gauge is up to about, let's see, it's going up to about 15, almost 20. So this is exactly where we need to be, no more over 20. Now, what this machine does is we have this little gauge pressure machine over here. This actually will alert us if we go over 20. You never want to go over 20. I'm going to show you what it sounds like if it goes over 20. I'm doing this intentionally. You'll hear it. That noise.
Okay.
That little, I call it the little farting noise. That is telling us that our pressure is over 20, and that's a little dangerous for a patient. We need to bring it back down. So you can check your machine over here and your gauge, pressure gauge, and you can see it. It's definitely over 20, so you need to bring your patient back down. Your patient's not going to die if it goes over 20 right away, but it does extend the lungs and can cause problems. Now, patients that actually have pulmonary issues and issues with their lungs period, you can do some damage. That's why you have to make sure you always turn this gauge before you turn this machine onto the left, always. But once you get a nice steady going, the 2 ways to monitor a ventilator, does anybody know what it is? It's gonna be your anesthesia machine, your surgery vet over here, and it's gonna be your CO2. Your CO2 is going to be your #1 monitoring for a ventilator. And the reason is we have that frame of the 35 to 45 that we want to stay in between. When these patients start to get on a ventilator and all of it's doing the work for them and they don't have to fight against you, once you get in that 35 to 45 range, they literally let go and they stop breathing for themselves. And they just let the machine take over. They stop fighting, they stay under. The only thing I usually tell people is when you get on a good flow of oxygen, you need to watch your ISO. When you start to see it drop under 35, then go under too much. So you just need, as they're getting under better, you can start dropping your ISO and they will run smooth. You can actually get them all the way down to almost like 0.75 on ISO, and they just run smoothly. But every patient's different. #1 rule with the ventilator is you cannot take a patient off of oxygen until they are breathing on their own. In other words, they cannot come off that ventilator until they're actually taking a breath on their own. If you take them off and they're not breathing on their own yet, you can kill your patient because you probably won't be monitoring after that. You're thinking they're breathing on their own. So you actually have to allow your patient to wake up. And the way to do that is you can drop your breaths per minute. Now, if you drop your breaths per minute, that actually lowers your respiratory flow too. So you have to make sure to bring that down as you're bringing your breaths per minute down. So if you bring down your breaths per minute as well as your the flow, you will actually control them not getting as much ISO and not much as a breath, so they'll actually have to start breathing on their own. So you'll see the patient actually resist against the bellow. So you'll see the bellow drop and you see it moving and fluttering and stuff like that. That means the patient is trying to breathe on its own. And then you just, of course, turn them off ISO. Even if the doctor is completely done with the procedure, you have to make sure that patient is on afterwards until they're breathing on your own. So
and that's the only way that you can tell that?
Yep, they will start fluttering against this machine. They'll actually start breathing against it.
Now, would you hook them back up to regular oxygen in the bag?
If you wanted them to be on a little longer after they're waking up just fine, because you want to time it. When you get really good at using a ventilator, you actually want to start to bring them down when you see the doctor's getting close to the end of the procedure. Because you want them to not be stuck on this ventilator waking up for about 10, 15 minutes. You want to make sure you're calculating it right. Okay, well, the doctor's got 15 more minutes. Let's go ahead and start waking up my patient. And of course, the things that are gonna bring your patient more awake is painful things like closing your suture, you know, at the end when they're actually in the skin and the dermis and the, you know, the nerves. So that will actually help your patient start to breathe on their own. And the patient doesn't have to be hooked up right away to a bag. They can still breathe on their own with a bellow. They will use it themselves and breathe against it. All you have to do is just turn it off. And that patient literally will get its own oxygen.
Okay.
You don't have to switch over to a bag. If you're more comfortable with the bag, you can. So anytime you're done with the ventilator, before you do anything else, make sure you open your pop-off valve, turn your knob to your left, and then release it. And your bellow will go down. And you just set this over the top like this. What'd you guys
You don't ever have to switch out bags.